Welcome to Module 5 of 6 in our series on work-life balance. I'm Tina Proctor, and I work in the College of Health Sciences at Appalachian State University. I'm also a doctoral student currently researching work-life balance. Today I'm presenting on behalf of Hubbard Programs for Faculty Excellence at Appalachian State University. Module 5 focuses on the elderly, including strategies which should help you tackle daily tensions surrounding the demands of caring for an older family member. You'll find a compiled list of all the strategies mentioned in these modules online on the Faculty and Academic Development website. Listen to all modules or skip ahead as best fits your needs. And remember, these modules are an attempt to bring information which will be pertinent to most. This can in no way address all issues for all individual circumstances, but I trust you'll find something which will prove meaningful to you. You are not alone. 40 million Americans aged 40 to 59 are helping at least one parent with daily tasks. 45% of these caregivers are men, and 70% have made workplace adjustments, including coming in late to work. Caregiver.org states that the average caregiver is a 49-year-old woman caring for her 60-year-old mother who does not live with her. She is married and employed. You are not alone if you face the task of caring for an elderly friend or family member. Perhaps you never expected to take care of an elderly person, and it's overwhelming at times. This is understandable. Reframing how you think about the situation might be helpful. Temporarily taking the perspective of your elderly patient might help. It's probably very difficult for your patient to relinquish control. This may make him or her difficult to deal with. They may also be embarrassed and upset over the perceived or very real loss of dignity. Be prepared to discuss personal and perhaps sensitive issues like toilet habits. Be as empathetic as you can. Talk to them. Try not to judge. Have patience and remove yourself from situations when necessary. It is okay to say you need a break. Trust in your ability to handle situations by becoming as knowledgeable as possible, but remain humble, as there's always something more to be learned. Some practical tips experts suggest include being aware of verbals and nonverbals, including your own and those of your patient. What are you intentionally and unintentionally communicating? What are they trying to communicate? Touch your patient. Studies show that touch not only signals safety, trust, and compassion, but that warm touch can calm cardiovascular stress. Be responsible, but set limits. You may be unable to comply with a request right away, so explain to your patient why. Build a community or team to support you. There are several factors which may further complicate taking care of an elderly family member. If there are more than one of you making decisions, communicate on a regular basis and try to make decisions together and with no hidden agendas. If necessary, ask a third party for advice. Sometimes the nature of your patient's illness will make them unable to contribute to the decision-making process. A patient with Alzheimer's or dementia may need you to make decisions for them. Enlist the help of healthcare professionals to make the best decision possible, and trust your instincts to do the best you can. In terms of your workplace, know your rights as an employee and communicate with your supervisor and colleagues. Before you contradict an old man, my fair friend, you should endeavor to understand him.